All right, everyone, I want to thank you all for coming out on Monday evening. Really appreciate it. And today we're going to talk about low back health and how to maximize your low back health. And the good news is you're already doing a lot of things that maximize low back health just by coming here and doing the things you can control. But I'm going to talk about some other things you can do. And these things usually go best if they're a dialogue rather than a lecture. So if you have any questions about anything, just speak up and ask your question, and I'll try to answer it the best I can, okay? So first thing is low back issues are very common. Over 80% of people will have a low back issue at some time in their life. As common as they are, however, they are also very what we call non-specific, which means when people have a low back issue, almost all the time people can't say specifically what caused it. 97% of them are sprains and strains, but it's from a non-specific cause, meaning we can't always say I was lifting this thing up and I tweaked my back, and as we know, it can happen sleeping maybe, or so many different ways that people can strain or sprain their back. And so it's extremely common, but again, very non-specific. So what I'm going to talk about today is mostly preventative things you can do, and I'm going to get a little into things that once you have a low back issue, what is currently being done, go into some research on a few things, share a few stories along the way, and again, if you have any questions, just speak up. There's no filter there. Whatever you want to ask, please do. So probably the most important thing to know about low back health and maintaining your low back health is that 80% of low back problems come from muscle weakness. Okay, so the muscles in the low back and in the stomach basically serve to support the low back and the discs in the low back. And so the stronger your low back is, typically the healthier your low back is. Now, an interesting thing about low back health and strength is it's not so much about being able to lift a certain amount of weights. We know the Olympics are about to come on, and all those people may have really strong low back muscles, but it's more about what we call muscular endurance, because as I'm standing here, my abdominal and low back muscles are working to support my spine. So if we think about our day-to-day activity, typically most of us, unless we're in some type of labor job, are not lifting heavy weights, we're not moving mulch bags necessarily, but what we are doing is standing like this, and this requires muscular endurance, and or sitting, which also requires muscular endurance, by the way. And so the back, the muscles around the spine, the low back, and the core muscles support the low back. So the more you can do to strengthen your low back, the better off you're going to be. Okay, so another thing to remember about low back problem, if you do run into a low back problem, is that very few ever result in surgery. It's less than 5% ever result in low back surgery. And contrary to some beliefs, most people in the medical profession are pretty conservative with surgery and stuff like that. The general phrase that is used in medicine is pain often gets better with rest, physical therapy, and light medication. Sometimes that medication is prescription, sometimes it's non-prescription. And let me again just say, as we go into some of these issues where you might have a low back problem, always consult with your doctor, of course. I'm not a doctor, I have no medical license of any type. And so if anything does come up, always check with your doctor. I always believe that's a gate we should always walk through before we do anything. And again, oftentimes doctors will do, again, like typically what they will typically say is rest, light medication, and often physical therapy, a little bit of physical therapy. I do encourage you to think about physical therapy being your friend. Physical therapy can be very helpful. Just like any profession, there are different great physical therapists and good physical therapists and maybe other physical therapists, but physical therapy can be extremely helpful if you have a low back issue. The other thing that's really important with low back health, and as you go forward, it's both strengthening, and if you do have an issue at some point with low back pain, is that the path is very individualized. This is probably the most important thing with low back health, is that when people have an issue with low back and they go to a physical therapist, or let's say they come here, this has happened before, where someone would go to physical therapy, the doctor clears the person, doctor says, yes, this person's good to exercise, and occasionally people have flare-ups. What is unusual about the low back is that it's not a linear path, it's not necessarily a templated thing we can follow. Person A, we could give one exercise and that person is fine. Person B, we give the same exercise and it might cause discomfort. So always remember that there is no one set path for everyone. If there are 10 different people with low back issues, they may have 10 different paths they can follow, maybe 10 different things they can do. And pain is always a stop sign. And if you have pain doing anything, always stop and communicate that to whoever you're working with. Okay, so like I've said already, the number one way to maintain a healthy low back is to strengthen your abdominal muscles and your low back. And I'm going to demonstrate some exercises that are really effective at that. And the secondary way to do that is when you're strengthening, and let's say you're doing a bicep curl, for example. And we instruct people when they're doing a bicep curl to brace the core. And so sometimes the expression that's used is every exercise can be an abdominal exercise or a core exercise. So if I'm standing here doing bicep curls and I do a little bend in the knees and I tighten up my stomach muscles and then I do the exercise. So the primary area is the biceps, but the secondary area is the stomach and the low back, and those muscles work. And I try to communicate that a lot when I'm working with someone, is that when you tighten up your core muscles like that on almost any exercise, shoulder press would be another example, deadlifts another example, that strengthens those muscles, the core, the abdominal, and the low back muscles. Does anyone have any questions about that? Okay, so again, like that, so you have those two basic ways. Exercises, which again, I'm going to demonstrate some of these, and many of you have done some of these, or at least seen them in this studio, because we do these a lot. So those direct exercises, and then the secondary exercises, which can be almost anything. It's not 100%, they're probably about 80% of our exercises have a secondary core strengthening benefit again. So pat yourself on the back for coming here, because you're doing the very best thing as far as working out. You're doing the very best thing you can do for your low back health. Okay, so I'm going to demonstrate a few of the exercises. Again, these are direct exercises, and the first one is, I'm not going to use a mat, I don't think I need one. First one is called a bird dog, and we've all seen this before in here at least, and many of us have done this. So with the bird dog, what we do is we're in all four position, and so the name comes from, if you've ever seen a hunting dog, those are called bird dogs, and so that's what this basically is. It's like a pointer dog. And so the first thing, the way I like to instruct this is to extend the leg and then extend the opposite arm and then come to a complete stop there for about a second. Okay, and then switch sides and do the same thing on the other side. Okay, and so we would do a total of 10 of these. And again, see how controlled I am. One great thing about this exercise is being in all four position can be very supportive for your back. Less stressful in many ways than standing on your feet, which can be very, very stressful for your back. So extending the leg out, extending the arm out. This is basically requiring the low back muscles to work. This slow pace is my strong preference. And sometimes over time, you can build up and hold it longer than a second. But again, if you'll feel this directly in your low back as you do it. And probably the biggest challenge with this is people get into what I call a to-do list mentality, where you're trying to get through, like, oh, I have 10 to do, I need to do 10. So the best way to think about it, a different way to think about it, is trying to do one rep perfectly and controlled and slow until you can feel it in your low back, and then do the next rep and do 10 total. So does that make sense? Okay, so again, like, it's a situation where the form is super important. It makes a big difference. Okay, so that's the first one. And the second one is side plank. So this is a great one. that works your the low back in this position. Okay, so side plank, what we do, first thing is, there are a few variations. We have a kneeling side plank where we do it on our knees like so. And then this is kind of the basic foundation of the exercise, this forearm here. Okay, so this would be one way to do it. We might do it for 30 seconds typically. And what we're looking for is straightness down the body. So from shoulder, hip to knee, everything should be straight. And the doing it not on our knees but on our feet, I like to bring this foot forward, gives it a little bit more stability. And again, come up on this forearm like this, and then again, straight down the body. Another instruction I like to give is tighten up everything in the back of your body, tighten up your shoulder blades, tighten up your glutes, and you will feel it here in the lower, in this side on my left side. So whatever arm you're on, I'm on my left arm, so I'm going to feel it in my left low back. Okay, so tremendous exercise. Like I said, on the knees is also a great version of this, and just like this. Okay, so, and then of course we flip it over and do the other side. Yes. Yeah. It is okay. I prefer the foot forward. You get for one, you get a little more stability, and it minimizes any risk of getting excessive low back stress. So all these exercises, we're doing both strengthening, but also minimizing any risk. So usually that foot forward, you get that little more stability, and you get the same benefit. Does anyone else have any questions about that one? Okay, again, that's generally considered probably the best low back exercise you can do, and just tremendous for strengthening in the low back. Okay, so, all right, so that's 2, and the next one is called a ball curl up. Okay, so I'm going to pull out our new ball we have today. I think we got this today. Miami Dolphin Blue. All right, so with the ball curl up, the target is right here. Okay, so when a muscle in anatomy is on the surface of the body, it's called a superficial muscle. We know we use superficial in a different way, right? When we say superficial, we often mean like maybe unimportant or frivolous or something. But in anatomy, superficial means on the top. So this one really works the muscles at the top right here of the abdominal area, which are technically called the rectus abdominis muscles. Okay, so what we do in this one, a few things with this one. First thing is the hips are in front of the ball. Okay, hands are across the body like this to the shoulders. And then one thing I always emphasize is keep the neck nice and rigid. Okay, sometimes you see people doing this in other gyms and the neck is going like this. And you don't want that kind of stress going through your cervical spine. Okay, cervical spine being basically above this notch right here. Okay, so you want to keep your neck nice and stable, and then you basically go back as far as you can go. Okay, again, so this is going right here, right in these abdominal muscles, and then you come back up about 3/4, and then you go back down. So if you look at my head, I'm not letting it flop around and keeping it nice. This also works your neck muscles. Okay, so, but directly targets the abdominal muscles. So, does anyone have any questions about that one? Right, so with one general idea with low back health is that you have muscles in your low back, specific muscles back there, a bunch of different muscles. You also have muscles up here. They both contribute to stability and low back health. I don't know if it's exactly equal, but they're both very important. So the stronger these muscles get and the stronger these muscles get, for some reason, I think in terms of buildings. I think of like the inside of a building. It's like you're creating more stability and structure inside of the building. And so the discs are very unusual in the body. The structure of the discs are very unusual and unique, and there's nothing like it in the body. So basically, we're just trying to create, sometimes people say a corset. It's another expression, like kind of an older expression, but creating anything that kind of creates the stability around the spine. So, and again, like both these direct targeting exercises like these, but also indirect, could be any exercise. You basically can get that strengthening effect largely by your focus on what you're doing. So again, like if you do a bicep curl, it's called a bicep curl because it works the biceps, but it also works the stomach muscles, or can. It should, shall we say. That make sense? Okay. So again, that one, a lot of these exercises you see, it's very interesting. There's not a lot of studies on this, but there should be. You get, by doing the form a little differently, you get a way more benefit, way more positive benefit. So just as, for example, on that one, a lot of like where the hips are located, keeping that neck nice and rigid, going back far enough, that what I call what's called the tempo, which is the pace that you move, the speed that you move, can make a huge difference. So again, like this kind of like quality over quantity kind of thing. It's not the perfect comparison, but it is like focus on the what we call movement quality can make a huge difference. And so one way to work on that is just kind of, again, what I try to do is like try to do one rep, kind of perfectly, and then generally keep track. Hopefully I'm at 10 at the end, or however many reps that I'm shooting for. But honestly, if I miss a rep or two, I'm not worrying too much about it. I'm trying to, get the best quality I can. And there's almost like a meditative benefit with that, actually. I mean, kind of get lost in it a little bit. At least I do. So I know everyone's not like that, but that is, like I said, one of the best ones right there. Okay, the next one is called Stir the Pot. Okay, and again, like many people have done this one. And again, the form is important, which again, this can be done on your knees. And I'm going to demonstrate it on my knees first, and then I'll demonstrate on my toes. Okay, so the main thing about this exercise is you want your body below your shoulders to be as still as possible. And actually, I was talking, just had someone in the 6 o'clock session, and I was explaining this to her, how that is the key to this exercise, that you want to keep that part of the body as still as possible. And as you move your arms, the benefit is based on how still your body is below the shoulders, basically. So I'll kind of walk you through that and then explain it again. So I'll show you kind of what it shouldn't look like. So stir the pot is basically you're in this position and you do circles. And when we do this, what we don't want is like hip movement. What we want is more hips completely still. So kind of like that. And then typically we do 5 in one direction, 5 in the other. So as I go up on so this is one level, and then on your toes is a little harder, a little more challenging. They're both great, and whichever one you do you're going to get a good abdominal benefit. But again, you can see my everything below my shoulders is going to be very still. So I'm just going to do 3 in one direction and 3 in the other. Okay, so and as I do that, I can feel that directly in my stomach. I mean, very directly. So a lot of these front abdominal exercises, that's the way to assess them. It's not that just that the reps are being done, but more so that you feel it in the target area. And I can communicate to you the target area in that one is these muscles right here, the ones in front. Okay, so does anyone have any questions about that? Again, a lot of these, yes. Yeah, no. More is, hey, makes. I want more questions.
You're not really going very wide and watching you. I always think it seems like I want to go wider. You're not going very wide.
Yeah, that's a very interesting thing, because it's so interesting that so many exercises, there's this intuitive response to do something. And this is one where the intuitive response is to go bigger, but it's really, it's what a lot of people do is they go bigger with the movement and they move their lower body. And what I always try to communicate is keep your lower body, basically not just your lower body, but everything below here, keep that as still as you can. And the size of the circle is not super important. Now, the size of the circle, if you keep everything still and you get bigger circles, that is more effective. But I always focus much more on keeping that part of the body still and then moving the arms less. Like I said, you can go bigger if you want, but that's the basic way that I do it. Come on, some more questions. Yeah, like I said, that is the, like I said, very intuitive and very common response to try to get bigger circles. But for me, it works better if I have, like I said, really focus on the stillness of 80% of my body, and then the movement there just a little bit. So, any questions, Linda? Okay. Okay, so did I go through all those? Okay, one more, ball rollout, which is obviously the cousin of stir the pot. Okay, so these are very close. And with ball rollout, it's the same, all the same basic ideas. It's just the arms do something a little different. Okay, so with ball rollout, what you do, again, I'll demonstrate on my knees. Again, really important that everything below my shoulders be still, and then I go forward like so. Okay, so if I were to do it on my toes, it's a very similar thing. Just make sure your arms are here, very supported by the ball, and then you go forward. Yeah, that one's pretty hard. Again, I'm much more concerned with the stillness than how far you move on that. Again, if you do stay still and you do move far, that's great, but there is this tendency of people to kind of do the opposite. Like there's some movement in the lower body and more, it's a bigger circle. So, any questions about that? I can say Joel, speaking of stories, Joel told me the other day when I was talking about this workshop that he had quite a bit of low back pain when he started, right, Joel? And then you said you dropped 10 pounds and started doing side planks, and that took away your low back pain, right? Yeah. And I can tell another story that a few years ago, I was doing a consultation with a client, and she told me she's been going to chiropractor for years and for low back pain. And I gave her the statistic about 80% of low back pain comes from muscular weakness. And she said, she was a little, she was nice, but she was a little skeptical of what I was saying. And she said, well, I've been going to this chiropractor for years, and he never told me that. I said, well, you can ask him about it, see what he says. And she asked him about it, and to his credit, he said, yeah, that's true. It's usually about 80% low back pain. She said, well, I've been coming to you for years. Why didn't you ever tell me that? She said, I would go to, she said, I would have gone to a trainer before. And he said, I'm not sure what he said. But like I said, to his credit, he confirmed that's true. And so that is a huge thing. And I do think there are a lot of people going to chiropractors that probably don't know that, and other professionals. Again, it's not any slam on chiropractors at all, but it is, the strengthening is such a huge portion of it. And you're saying, can they help? Or you saying? I mean, I think some of them probably can. I mean, this is kind of more of an opinion than anything. Again, just as some chiropractors have an incredible, I mean, all chiropractors have a really good knowledge of anatomy, and then a lot of them have a really good knowledge of a lot of different modalities. Like some of the best ones know something about strength training, they know something about chiropractic, they know something about some of the stuff I'm going to get into later. They know some of the stuff about physical therapy. And so in some ways, I know some chiropractors do great with that, and then others might do different things. And so I do think they can potentially help. But again, it kind of depends on the chiropractor you're going to, I guess, just like anything. But I don't rule them out, so. Does anyone else have any questions about any of that? Okay, so there we go with that. All right, so that's one of the two most important things, is trying to strengthen. I just showed 5 of those. There are other things we can do. And if you're here working on a regular basis, you're not doing these things, there are other things you can do. And again, like every exercise you do potentially can strengthen those areas. Again, it's something as simple as a bicep curl. I always try to communicate that that's actually also, so it does work your biceps, that's in the name, of course, but it also can work your stomach muscles and your low back. Okay, so in general, the idea is like try to use as much weight as you feel like you can handle. A lot, because not just for the bicep curls, but also for that benefit in the middle of the body like that. Okay, so that's the first thing. The second thing that's really important, and we all know about this, is that the environment in which we exist is also extremely important for low back health. And the environment we exist is largely a sitting environment, as we know. And my take on this is that you read a lot about this, a lot of criticism about this, but this is just the reality. We live in a sitting environment. That's not going to change. However, the goal is to try to move more and throughout the day. And that would be my suggestion. Similar suggestion I make for nutrition. It's like, don't necessarily think about eliminating all these things. Think about eating more things that you like. So, not a perfect analogy, but but with low back, moving more is better. And our basic default thing is if you're sitting in an office job or anywhere, if you're sitting at all, try to get up every 20 to 30 minutes and move around a little. We hear a lot about like standing desks and stuff like that. And I think those things can be part of it. However, the opposite of sitting for low back health is not standing, because if you stand all day, like someone in a retail operation or other people that are always standing, that is also not ideal for your low back health. What's more ideal is more movement. So walking, for example, is really good for your low back health. Kind of fidgeting a little. If you're a fidgeter, that's good, because A, it burns calories, and B, it can be good for your low back. Okay, just that little bit of movement. And so again, like standing desks are not wrong. They can be part of the solution, but the answer is not necessarily to go from sitting all day to standing all day. The answer is some movement. And again, I just think we're going to sit. It's not going to completely go away. But the more movement you get, the better. And this is one way I kind of think, kind of an indirect way, where step counters can be good, right? Because if you, let's say you go for 8,000 steps or whatever you go for, if you get that on a daily basis, you're going to be, moving more, right? So in a non kind of structured way, but just throughout the day, I need to get some steps. I need to get 500 steps or 1,000 steps. If you do that, the more you do that, then the more movement you get, which again is kind of the ideal. And so like I said, I'm not trying to say, oh, let's eliminate all sitting, because we can't. It's not possible. But we can try to move more. So whatever you can do with that. And this is the thing. Honestly, I would say when I was younger, I didn't really get this. Like they would talk about parking in the back of the lot and walking to the grocery store. I was like, are you serious? But now I get it. I'm like, yeah, I try to do all these little things. Like I'll walk to the bank. I'll walk these little short walks. And they really, and only when I started to track my steps did I realize how much that really adds up over time, throughout a day. You get these little like 500 step little jaunts that really adds up. So again, like that is indirectly really good for your low back, because you keep that movement going. Okay, so the other thing about that and sitting environment is it causes our hip muscles to tighten up. And so pretty well proven that if the hip muscles are tight, that tends to cause low back problems. So I'm going to show you a few stretches for the hips. And generally, hip stretching can be good for low back pain. It's something studied pretty well, and getting some good hip stretches can be good. Now, the thing about hip stretches is for some of them in particular, you have to be, there's certain steps you want to take with them, just like with weightlifting. So it's not a big deal, but there are certain instructions. And so the first one I will show is probably the most common hip stretch you may have seen, and that is the fan got me. The muscles right here above the thigh, or above what's technically called the quadricep, is called the hip flexor. There's a muscle there called the hip flexor. And anytime you sit down, those muscles get tight. And so if we look at how much we sit, those muscles get really tight. Okay, so this stretch is one of the best ones for those muscles, hip flexors. And so with the hip flexor, again, we're trying to stretch this, but again, we want to be a little cautious with this one, and I'll explain why. So the hip structure and the hip capsule in there can actually be a little bit vulnerable. And sometimes I think, maybe because of things we see on social media or something, we think of stretching as being like an unlimited good. And stretching can be good, but there's certain limitations with stretching. And for example, sometimes you see with this hip stretch, if someone brings their hip way out like this, and I will tell a story on someone that happened in here. This is years ago, no one around currently, but I gave this instruction I'm about to give. And I said, so when you do this stretch, make sure you kind of keep your glute muscle tight, okay, and just come forward a little bit. Don't come way super far forward like this, because that can actually compromise the integrity of the hip capsule. Again, a lot of times you see stuff on the internet or whatever, and their hips are way up like this. And what we actually want to do is tighten the glute muscle right here, and then just come forward just a little bit, just kind of like this. Okay, and over time you may slowly go forward, but oftentimes with stretching, it's good to have a little bit of stability as well. And so the stability here would be coming from the glute. Okay, so we tighten the glute muscle, come forward there a little bit like that, and that will give a really good stretch. And the story is, so I gave this instruction, said, does that make sense? So now I know how people tend to do on this exercise. So I said, okay, so you're gonna do that, right? Like that, right? Just go forward a little bit and keep that hip tight. She said, yes, yes. I said, okay, and like kind of emphasized it again, and then walked away, and her hip was way up like this. I mean, it was like 10 seconds later. There's just, again, like, it's one of these things, like you were asking kind of about the stir the pot. There's this tendency, and I've just noticed this from so many years in training, of some of these things just people do, everyone does it almost universally. And that's one example where people want to bring their hip really far forward, which again can potentially be damaging to the hip. But if you keep the glute nice and tight and just come forward a little bit and just kind of progressively, like so many of these things, progressively stretch a little bit more. Again, you do both sides, of course. Okay, so that's a really good one with that one caveat included. And so the next one's called a pigeon. This is also a really good hip stretch. And so with the pigeon stretch, the basic idea, the name comes from I look like a pigeon, right? If you look at, here are my little pigeon feet, and here's my little pigeon, whatever that's called, chest or breast or whatever it is. Okay, and so kind of walk your hands back to your knee like this, okay, and then just sit up really, or prop yourself up really straight, just like a little pigeon. I didn't know why it was called this pigeon for a long time, but this is why, because you look like a pigeon. Okay, but it's a great stretch in the hip, and you just hold here for about 30 seconds. All these stretches are at least 30 seconds. So you hold for 30 seconds like that. Again, you can kind of see where my knee is aligned with the middle of my body. I'm kind of walking up like this, and that is a really good stretch. Okay, so and then again, you do both legs at least 30 seconds. And the next one is called just knee to chest. And this is a super basic one. This is actually not even, there's very little movement in this one. So knee to chest is just basically, oh, I have these socks Martin gave me, by the way. These are the best socks I've ever worn. Okay, so this leg is straight, and then this knee, you just come like this. It doesn't have to be 100% straight, but basically straight, and you just pull to your chest and hold for 30 seconds. Another really good hip stretch. Oh, it feels good. I might stick with it for a while. Oh. So those are 3 good hip stretches, which again, work on your hip mobility can improve your low back health, especially if you're having some discomfort in your low back. Does anyone have any questions about those stretches? Anyone have questions about my socks? What was the brand again?
Hurley.
Hurley, yeah, that's right. These are the best socks I've ever worn. For a variety of reasons, it can throw off your posture. It can cause pulling through that area. It can limit. So there are certain ways we should move ideally. And when our hips are tight, we probably don't move quite as well as we should. So there's several reasons, probably some reasons we don't even know about. So, all right. So the other expression is motion is lotion. That's an expression about movement in our low back. So the more we move, the better. We actually have a little handout here, and we have the thing about moving every 20 or 25 minutes. And we have one of the things, the person's dancing. So if you get up and dance, that's good too. So anything you do, again, movement. So those 2 things, the things I've talked about so far, strengthening the area around the low back, and then trying to move more and do whatever we can to improve that. And then again with those stretches. So those are 2 things. And so now I'm going to go into some other things that are, some of this stuff is kind of relatively new. Been some research in the last few years, and a lot of this stuff comes up if you do have a low back issue. So again, I have to reemphasize that I'm not a medical doctor. I don't have any medical license, can't make any recommendations, can't do any diagnoses. But these are things you might keep in mind if you ever do run into a low back problem. Okay, so the first thing is that acupuncture is something that some pretty good results coming with acupuncture and low back pain, and some insurance will now pay for acupuncture, I believe. So you might want to check with your own insurance, talk with your doctor. But acupuncture is something that they're showing there's some good results with low back pain. And the interesting thing about acupuncture is acupuncture runs on what are called meridians. And they have assessed the meridians against what's called myofascial sheaths. So has anyone ever heard of myofascial tissue? So myofascial tissue is the tissue between your muscle and your skin. It's like a netting. And this is something, again, that's kind of new in research they're learning more about, is like different difficulty that people have with myofascial tissue and different problems, just like not quite like muscle, but similar, where people get irritations. And so the theory that I've heard is that the acupuncture may be relieving this myofascial discomfort. And so that is one theory. Again, like, I can't say that's proven, but that is a theory potentially about myofascial or acupuncture and pain relief. So that's one thing. Another thing is Tai Chi. So Tai Chi is another thing. And again, it's interesting as I go through these different, what might be considered alternative approaches or whatever, someone told me, they said, well, what's really important is when you communicate these things is how people hear it. So if someone hears it and says, oh, that's nonsense, well then don't even really talk about it. So much of it is like, in a sense, our receptiveness to it, I guess, like so many things. Again, so Tai Chi, again, something I thought, well, it doesn't really look like very good exercise, honestly. I always thought. But the thing with Tai Chi is this idea, which again, you see a lot of this low back kind of treatment stuff, is kind of light, gentle movement. And however, with Tai Chi, they typically teach some type of stability as well. So it might be starting from the feet, and you get this movement, you're kind of doing these different moves. And this stuff can be potentially very therapeutic for your low back. And somewhat similar too with some of the yoga poses. Again, like yoga, like some people are open to it, some people are not. But different type of yoga moves can also be potentially therapeutic if you do have low back pain. Again, it's also, as I stated before, and this is probably one of the most important themes of this whole workshop, if not the most important, is that as tolerated, right? So one thing I always found interesting about yoga is some people say, I went to yoga and I tweaked my back. And then someone else says, I went to yoga and my back is healed. So it's interesting, like what's actually going on there, but some of it is certainly just individual tolerance and individual, path. Again, like it's going to be a very different path for very different people. Does anyone have any questions about that? So again, I'm not really a Tai Chi expert by any means. I've watched it a little bit, and I have not done it, but I've studied a little bit about it. But the big thing for low back is that steady, it's movement, it's light movement, it's gentle movement. It's something that maybe some people that are doing Tai Chi couldn't tolerate something, more intense. So similar with yoga at times. So another thing now is called mindfulness meditation. So this is something, again, this is very popular now. And again, like people hear this and they say, oh, this is woo-woo or whatever. I don't know if it is, but they are starting to study this more and more. And I'm going to lead into another point around pain about this, but with mindfulness meditation, the idea is we basically have, our body can function in two different ways as far as the nervous system. There's what's called the sympathetic nervous system, which think of stress. So sometimes that's called the fight or flight response, right? We know that in our body, if we're threatened, if we're going on a hike and we see a mountain lion, our heart rate's going to increase, our breathing's going to speed up, and that's called the fight or flight response or the sympathetic nervous system. And so that we tend to associate that with, in a sense, again, threats. And however, we don't often run into mountain lions here in Westchester, California. So that that is still in our programming, shall we say, for lack of a more technical term, that when we get stressed, that happens. That sympathetic nervous system gets jacked up, whether it's from driving, from just dealing with life, from deadlines at work, and so that stress tends to increase. And again, sometimes it's almost like that gets on a stuck button, and so we tend to be hyped up like that. And so the parasympathetic nervous system is basically the opposite, where we calm our body down. And so how is that done? Formally or in a structured way. Meditation, many different ways to meditate. I'm not going to go into a bunch of details about that, but we know there are many different ways to meditate. There is what's called breath work. I don't know if you've heard anything about breath work, but breath work is basically where you breathe in for a certain period of time, typically hold your breath for a short period of time, and then breathe out. What it's basically designed to do is slow your breathing down. When your breathing slows down, your parasympathetic nervous system kind of kicks in, causes your body to relax a little bit, and some of this fight or flight response kind of calms down. That's the idea, at least, right? That's the objective of, from a very, and my take on, because I am a believer in meditation, I actually do it, but my take on it is very physiological. I'm not interested in anything beyond the physiological in this stuff, because it just is so impactful on the parasympathetic nervous system, which again, kind of causes us to calm down, and that can lead to all kinds of implications around our brain, how we react to stress, how we react to pain, and a lot of other things. So again, like meditation, so many different forms of that, breath work, different forms of that, and that is all falls into the category of, it's called mindfulness meditation. So again, all this stuff can lead to some low back stuff, which I'm about to talk about. So the current most interesting area to me in research around low back pain and just general pain in general is the idea that we have this, again, programmed into our body about threats, like worrying about threats. And I'm going to just share you my own personal story about this, by the way. About a year ago, I started to have this pain on the side of my body. I didn't know what it was. Actually, I think I know what caused it. I knew someone that was trying to go in the Navy SEALs. I said, I'm going to try to do this same program. Probably a mistake, Navy SEALs probably 21 or 19. So anyway, somehow I managed to do something. I think I probably did something in my myofascial tissue. And it started to hurt. And so I'm like, oh, it's not that big deal to go away. It didn't go away. I started to kind of worry about it. And started to get more intense. And then started to go to the other side. Got more intense. I saw a bunch of doctors. And no one really, they did a bunch of tests, but they didn't really find anything. They didn't really say anything. They didn't give me really any guidance either way. Not their fault. They were just, they were doing whatever they did. And it just kind of increased and increased. And eventually I could hardly lift weights at all. And so eventually I was sent to this physical therapist. And as I was, part of the worry that I had was I didn't know what it was. And I didn't know what was causing it. And I didn't know basically, what's the significance of this? Like, what does this mean, right? Like, and so they sent me to the physical therapist, and the physical therapist started talking to me about the ability of our body to elevate a pain through the fear of what the pain might be. And so basically what he told me, it's not that I created it's not in my mind, I didn't create it in my mind, there was a physical issue there, but my mind basically, our nervous system could increase the pain. And again, this is an area where there's been a lot of research in the past 2 or 3 years, and in one specific study, they had a similar type situation where people are doing things, or had a similar situation like I did, and they had them do, I believe it was 1 physical therapy appointment, but they had 8 counseling sessions where they explained to them this kind of idea that your brain can potentially increase pain. Doesn't mean you made it up, it was real, but your brain, because of concern about what it is, can increase that pain. And in this study, at least, they reported 100% success where the pain decreased significantly and or like basically went away. And so, again, like my story was this physical therapist explained this to me, and he did do some myofascial kind of movement with me, But basically within 30 days, the pain that I had was pretty much gone. And I just found that from that point, I got completely fascinated with that idea, started to read some different things and read some different research. And again, it's kind of a newer area. And the basic thing, the way low back pain goes, again, like this comes up, talk to your doctor, don't talk to me, but is that typically acute pain is what's typically considered less than 90 days. And chronic pain is over 90 days. And so sometimes people define acute pain as less than 6 weeks, but generally it's like less than 90 days. 90 days is the break off. And so almost all acute pain kind of goes away. Chronic pain, what current belief is some of the chronic pain, again, doesn't mean people are completely making it up, but people start to worry about it. Again, like, is this going to debilitate me? Is this a heart problem? Is this cancer? Some people could worry about that. And that tends to increase the pain, or at least potentially can. And so again, like a lot of stuff around this, and just like kind of what I call pain perception. How do we perceive pain? Again, some pain that might have nothing to do with this. And so the way they typically do is like they might do structural exams, MRIs or whatever. But if they do all the testing, they've done everything. And again, like sometimes this is at play. And so I just wanted to share that. Again, my own personal story with that, because I went through it personally. And if you would have told me before that, I would have said, I'm not susceptible to that. I don't think that could ever happen to me. Like I would say, I've had enough injuries through my life and they all kind of eventually go away. And so, but in that specific situation, because I didn't know what it was, and of course, part of it was Dr. Google, I went on and started reading stuff, and it's what every doctor tells you not to do. And so that made it worse and started to worry about it more. And again, it's about a year ago. And again, this physical therapist, to his credit, really explained it to me very well. And it was very helpful. And again, he also did some movement, but I had one physical therapy appointment and it was basically gone 30 days later. So, does anyone have any questions about that?
I have something similar. My daughter's friend, so like around 34 years old, started having chronic pain. She didn't really have any reason for it. And the longer it went, the more difficult it was, and it wasn't being diagnosed as anything. And it really became problematic. And so they were saying, well, is it Epstein-Barr? Is it something, similar to that? And she finally, after literally a year of just getting increasingly worse and really diminishing her ability to participate in life, really, because it was to that extent, she found somebody like you did that said to her, this is not going to seem like what you should be doing because you've been sitting and avoiding pain and worrying about the pain and focusing on the pain. Instead, you really need to work out a minimum of 6 days a week. You need to have exercise enough to not only just cardio but strengthening as well to go back and forth on those across the 6 days, so that she's focusing on the movement and on the benefits that brought, and literally all the pain is gone.
Wow, that's amazing. Thanks for sharing that.
So that was pretty stunning to me because I just kept asking my daughter about this friend, and I just saw her, and she's like in great shape, and she's very committed to continuing to do this. And talked a lot about the mental health part of it, that the endorphins and things like that it brings to her, specifically, that changes how she feels physically.
Yeah, that's an amazing story. So, yeah, and we wonder how many people are experiencing this now, right? Because again, it's not necessarily something that everyone's very knowledgeable about in the medical field. And again, I'm not saying anything medical, what people should or should not do, but it's something to keep in our back of our minds if we ever do have pain. But again, like it's also a sensitive topic, right? Because someone might hear this, and I was a little hesitant to bring it up, honestly, but someone might hear this and say, "Oh, you're saying it's all in my mind." And no, it's not what's being said, but it's kind of like trying to learn more about it, I guess. So. All right. So, does anyone have any other questions? Okay, so just in wrapping up or summarizing, so I've talked about some basic, just the most important thing, and all give yourself a pat on the back because you're all working out here. So you're doing what you can to strengthen your abdominals and low back, so that's good. And that's generally the most important thing. The thing that we can do a lot about is our environment. Now, I don't think we can completely perfect our environment. Again, like our sitting environment is not how our bodies evolved, I don't think. But we can improve, right? So I always think about, instead of trying to solve a problem, let's just try to improve it, mitigate the challenge of the situation. And so, so moving as much as possible, doing the hip stretches. And again, I got into some other things. If you do ever have a low back issue, talk with your doctor about these things potentially, or physical therapist or whoever. And these are all things that potentially might help. Again, like things like breath work, meditation, issues around pain perception, and all these things can, again, like yoga, acupuncture, these are all things that might potentially work for different people. And so we just don't necessarily know what's going to work for everyone, but between you and your doctor, if it does happen, so just giving you a little bit of education in the sense of like for the future, hopefully. So I want to thank all of you for coming out. You're a great audience and very attentive, and really appreciate that. So that's all I have. You're welcome. And I have a little outline if anyone wants one. Okay. Yeah. The thing is, if you give the outline out before, then everyone's looking at the outline the whole time. Yeah, that's awesome.
Thank
That's
you.
incredible.
Yeah, it's important to think about.
Yeah. It's kind of